Good afternoon, everyone. This is Christine at Health Current, and thank you again for joining us for the DAP CYE 2022 requirements for hospitals, inpatient facilities, and Indian Health Service, IHS, as well as 638 providers. Our presenter today is Christy Dye. She's our Chief Business Development Officer. Christy.
Would you like me to take it away, Christine?
Yeah, I can hear you.
Perfect, thank you. Well, as Christine said, good afternoon and welcome. This is the first of two Health Current webinars on the 2022 Differential Adjusted Payment Program, or DAP as we call it for short. As she said, my name is Christy Dye, Chief Business Development Officer for Health Current, but I'm joined today by two colleagues, Caitlin Mugan, Director of Client Support and Success, and Jamie Pena, Manager of Provider Recruitment and Engagement. And they'll be available in the last 15 minutes of this session to answer questions from the audience or in the chat as part of our Q&A session. So we look forward to providing some detailed information about next year's DAP program, so the 2022 cycle, including eligibility to participate, incentives, milestones, and HIE requirements, and the HIE quality improvement portion of DAP. Christine having a little difficulty advancing the slides. There we go. As I said, we'll have about 15 minutes at the end for Q&A, and we will also be posting a frequently asked questions document on our website at the end of this session. So in some cases, if we need to do a little bit more research in order to get a complete answer to a question that's asked, I will make sure it gets added to the Q&A, the FAQ document that gets posted later. So we're going to go over some basics about DAP, the letter of intent submission process, HIE requirements in this year's DAP program, focus in a little bit on the data quality strategy, which is relevant to a lot of the providers in this audience today. And then we'll talk through actions that need to be taken, roles and responsibilities by those of you who want to participate in the DAP program, as well as Health Current, to make sure we can get everyone across the finish line. So the purpose of this webinar is really to focus in on the DAP program for 2022 requirements. These are the eligible entities that we'll be discussing today. But just a little bit of background on what the Differential Adjusted Payment Program is in the first place. It's actually an access initiative. We started about 2017 to reward providers who go the extra mile or take extra steps, undertake actions that improve patients' care, the quality of their experience and their outcomes, and reduce cost of care. Being part of the Health Information Exchange and being connected and using the Health Information Exchange is a significant portion of the DAP program. There are other requirements. When you read the public notice, the preliminary public notice that's posted on the Access website for the 2022 DAP program, you'll see that there are other requirements in there. Today, we'll exclusively be talking about the HIE portion of that public notice, and those are the only parts of the DAP requirements that Health Current is involved with. Again, as I said, DAP is a way for Access really to reward and incentivize providers. The schedule for DAP, so meaning the dates of service for which a provider would be paid, that enhanced claim rate, is called a contract year end, but it's basically equivalent to the federal fiscal cycle. So the period in question for this year is October 1, 2021 to September 30 of 2022. So this program starts next October. Just a little bit of action so far is the preliminary public notice was posted January 29th. There was a revised version posted a couple days later. We are accepting public comment on the preliminary public notice through the end of this month, which is next week. And we anticipate a final public notice to be published on or around March 26th. We're providing here the links both to the Access website and to the additional information about participating in the DAP program that you'll find on the Health Current website. This is a key piece of the public notice. It indicates which provider types are eligible to participate in DAP-related programs. The only change from last year is that we have now added nursing facilities, provider type 22, So they're newly eligible for the DAP program starting next October. All of these other organizations have been in for the last couple of years. Just high-level summary of some of the changes in HIE requirements. They continue to be progressive. So for each provider type category, the year that you enter DAP, the requirements build on the prior year requirements. So it's progressively a little more complex. We did add the COVID-19 testing, antibody, and immunization code milestone requirements, as well as the external lab authorization requirements for all provider types that will be eligible to participate in DAP this year. For the IHS 638 programs and integrated clinics for the first time, we'll be signing off on a data quality scope of work in 2022 and starting preparation for the data quality improvement program. And then for hospitals, critical access hospitals, and other inpatient facilities in hospitals, you have the opportunity to participate as a new DAP HIE requirement in Health Current's Social Determinants of Health closed-loop referral platform or the Advanced Directives Registry. And I'll give more details about that in a moment. So back on the letter of intent, key deadline must be submitted by April 1st of 2021. Even if you are currently in the DAP program for the 2020 year, you must submit a new letter of intent in order to participate in next year's round of DAP. And then, as always, we just say first come, first serve, so get in line. This is just a quick kind of overview from Access about the HIE requirements that are in DAP and how they build progressively over time. So this shows almost a 10-year view of the DAP program with regard to the HIE strategies and milestones. Talk just a little bit about the letter of intent submission process. It's a signed document. The document contains, or at least if you use the Health Current templates, which we strongly advise, that document contains all the milestones and requirements that the provider is agreeing to achieve in the 2022 year, or if the provider is in the current year and is already achieving those, that you agree to maintain in 2022. So you can find those templates located on the Health Current website. We've tried to make it really clean this year for identifying which provider type template you need to select. You would email those documents no later than April 1st to this email at access DAP at easyaccess.gov, and DAP at healthcurrent.gov. So you need to email them to both locations. And these are new email addresses from prior years. So don't use prior year public notice information, because both of us have changed the source email for DAP for 2022. This is just a really high level summary with lots of detail about all the many milestones and requirements as they apply to the different provider types participating in the DAP program. So when we post this deck on our website after today's webinar, you'll have an opportunity to go in and look at this in some detail. These are the provider type categories that are available to participate in the 2022 DAP program. Again, most of these provider types have been in years past. The new addition down here, third row from the bottom, is skilled nursing facilities. This is their first year, 2022, to be able to participate in DAP. But as you can see, we have a significant participation from all types of inpatient and hospital environments in our state, as well as integrated clinics, behavioral health clinics, and IHS 638 programs. Requirement for all providers. So for most of you do have the submission of data requirement, particularly if you've been in, if this is not your first year in differential adjusted payment. So for any milestone that includes electronic submission of patient information, it needs to be actual patient information. It cannot be test data. And it has to include all patient data that you're capturing in your EMR that is delivered by your organization. So that may include protected data, protected behavioral health data, or data that is covered by the substance abuse confidentiality regulations at 42 CFR Part 2. Okay, I'm going to move into the specifics of the different provider types. For the most part, all the inpatient settings have identical requirements. So I will spend most of my time on this first group here, hospitals subject to APR-DRG reimbursement. And that would be the same set of requirements for critical access hospitals and the other inpatient category. And then we'll spend a little bit of time on IHS 638 because that is different. So of course, eligibility for this particular program is for provider type 02. The very first milestone is getting in that letter of intent to access and health current no later than April 1st. Second milestone relates to the COVID-19 requirements I mentioned earlier. So no later than May 1st or 30 days after the LOI date, or by the hospital's go live date if you're adding a new data supplier, or within 30 days of beginning COVID-19 related services for your current data supplier. So what this all means is it's no later than May 1st, 2021, if applicable, if you're actually delivering these services. Submit COVID-19 test results, test codes, and the associated LOINC codes to Health Current. If you're doing antibody testing services, submit the COVID-19 antibody test codes and associated LOINC codes to Health Current. And if you're delivering immunization services, submit the COVID-19 immunization codes and the associated CDC recognized code sets to Health Current no later than May 1st or within 30 days, if applicable. Also for May 1st, 2021, if you're using an external reference lab for any lab result processing, you'll find on our website a provider authorization form that needs to be completed for each site that uses that reference lab. Actually, you can put all the sites on one form and submit it into Health Current. And what that allows is that it gives approval for that external lab to begin flowing their lab test results through HIE. Milestone number 4, no later than May 1st, 2021, electronically submit all of this actual patient identifiable information to the HIE production environment. And so that would include the ADT information, as well as if there's an emergency department, labs, radiology, discharge summaries, prescriptions, meds, et cetera, et cetera. You can see the list here. And again, this has to be actual patient data, not test data. Milestone number 5, no later than November 1st, 2021, the hospital must approve and authorize a formal scope of work to initiate the data quality improvement program for 2022. So we'll talk a little bit more about that toward the end of this presentation. There's a whole process that's being kicked off by Health Current this week. As a matter of fact, starting tomorrow with some of our advisory councils, I'm beginning to frame what those data quality measures will look like for this year. And then as well, there's a stakeholder input process for folks to get to provide their public comment back on the proposed measures later this spring. Also, no later than November 1, 2021, the hospital must approve and authorize a scope of work to initiate connectivity to the social determinants of health closed loop referral platform that will be launched by Health Current over the next several months. Milestone number 7, no later than January 2022, the hospital will complete the initial data quality profile as part of that data quality scope of work. And in milestone number 8, by May 1, 2022, the hospital will complete its final data quality profile in alignment with that data quality scope of work listed in milestone 5. The quality improvement performance criteria, these are actually identical to what we used in the current year for DAP data quality initiative. So hospitals would be eligible to receive those DAP payment increases if they can demonstrate a 10% improvement from the baseline. So based on July 2020 data to the final data quality profile, which is based on March 2021 data, meeting a minimum performance standard of at least 60% based on the March 2021 data. And if performance overall meets or exceeds the upper threshold of 90% based on the March 2021 data, the hospital meets the criteria regardless of whether you had met these prior percentage improvements from the baseline measurement period. And how that breaks down for the incentive part of the program. Data source and data site information, which is called Measure 1, must be submitted on all ADT transactions, and that's worth 0.5% incentive. The event type must be properly coded on all ADT transactions. That's worth another 0.5% incentive. The patient class must be properly coded on all appropriate ADT transactions. That's also worth 0.5%. The patient demographic information must be submitted on all ADT transactions, 0.5% incentive. And then there's a score for the overall completeness of the ADT message, an additional 0.5%. So the total possible incentive to hospitals for all these categories is 2.5%. I'm assuming people are putting questions in the chat. I'm not able to see the chat right now, so please encourage you to share your questions. Again, the next two sections, critical access hospitals and all other hospitals and inpatient facilities, are for the most part identical to what I just went through with provider type O2 hospitals. So I'm just going to move through this rather quickly. I think one of the key distinctions here is that a critical access hospital needs to be designated as such by March 15th of 2021 in order to be eligible to be in the DAP program. So about 2 weeks before you send in your letter of intent. These are the COVID requirements that we just went through. May 1, 2021, or within 30 days, if applicable. This is the external lab, reference lab requirements, May 1, 2021. Electronic submission of actual patient identifiable information, May 1, 2021, under milestone 4. Milestone 5, completing that data quality scope of work by November 1st of 2021. And then similarly to provider type O2 hospital, by November 1, 2021, the critical access hospital must approve and authorize a formal scope of work to initiate connectivity to our SDOH closed loop referral platform. Milestones 7 and 8 refer to the January 2022 initial data quality profile and the May 1st, 2022 final data quality profile. We have the same criteria I just went through for hospitals. And then the quality standards and related incentives. Big difference here is that for a critical access hospital, the total possible incentive is 10% overall. So it's 2% for each of these criteria that are successfully accomplished on the ADT transactions in terms of completeness of data, coding and completeness. Total possible incentive for critical access hospitals, 10%. Other hospitals and inpatient facilities. So this is a large category. As we go through, we're just going to call it hospital, but it does include a variety of provider types, everything from psychiatric hospitals, except Arizona State Hospital, provider type 71, secure and non-secure RTC settings, subacute facilities, provider types B5 and B6, rehabilitation hospitals, long-term acute care hospitals, all of which are eligible to participate in DAP under this category. So this would be the letter template that you would look for. Again, first milestone, having an active participation agreement and submitting a letter of intent. These are the COVID requirements, same as the other groups. So by May 1st, 2021, or within 30 days, if applicable. Submit COVID link codes and COVID immunization code sets. Again, if you use external reference lab for any lab result processing, you'll find a provider authorization form on our website that allows you to list those sites that use that external lab, and we work with that lab provider, and that gives them authorization to be able to send all your lab test results to the HIE. Milestone 4, submission of actual patient identifiable information, no later than May 1st, 2021. Milestone 5, approving a formal scope of work to begin the data quality improvement program on November 1st, 2021. Milestone 6, no later than November 1st, 2021, this group of hospitals must approve and authorize a formal scope of work to initiate connectivity to either the social determinants of health closed loop referral platform or the advanced directives registry platform operated by HealthCurrent. So this group has the choice of one or the other. Again, for all of these milestone 6 platform connectivity to the platforms, first come, so first serve, so get in line. I mean, just get your letter in, sign things on time, but we don't want a backlog for people through. Other hospitals and inpatient facilities, milestones 7 and 8 are the January initial data quality profile and the May final data quality profile for next year. Same criteria as we discussed in the other hospital settings. Same measure categories. Total possible incentive for all categories for this group of hospitals and inpatient facilities is 2.5%. Okay, IHS and 638 tribal facilities. Eligibility for this program, these are also provider type 02, is to be designated as an IHS or tribal owned and operated hospital by March 15th of 2021. That makes you eligible to apply to be in the program and receive the increases. So milestone 1 is the April 1 submission of the letter of intent, making sure you have an active participation agreement with HealthCurrent. Milestone 2, again, the COVID testing requirements and immunization requirements, all by May 1st, 2021. Also the external reference lab requirement, also May 1st, 2021. A little bit of a change here under milestone 4. So IHS and 638 tribal facilities, their electronic submission of patient data deadline is June 1st, 2021. For other hospitals, it was May 1st. So it would include this list. And we did create a catch-up period for any new IHS 638 hospitals that have not participated in DAP in the past and want to participate starting next October and send in a letter of intent. They would have, this deadline would have an extension to November 1st of 2021 in order to submit actual patient identifiable data. 5, 6, and 7, the same milestones as we saw in the other hospitals relating to scope of work for data quality, including an initial data quality profile and final data quality profile. One caveat that we have to put out here every year at Access's request is that the IHS 638 facilities incentive actually applies to the all-inclusive rate. So it really is subject to the state plan amendment approval by Center for Medicaid Services that did happen last year. And Access submitted for that. So we're assuming and are hopeful that that will be the case for 2022. I'm going to talk just a little bit about the data quality program itself. So many of the hospitals are now in that environment. So this is what we call our 4 pillars at HealthCurrent. Integration, acquisition, quality, and management. And that's kind of the foundation of making sure that you can count on the data that you access or receive from HealthCurrent as being as complete and consistent as possible in terms of coding by using national standards applied to data quality. So this fits in with kind of our overall vision for the health information exchange. What is a data quality profile? So it's a picture, a snapshot, an analysis of the completeness of the data sent from the participant to the HIE, and that includes using nationally standardized codes and technologies for ensuring that that data is standard and complete. The purpose of it is to identify if there are gaps and help providers, help current to work with providers to close and improve any gaps that are seen for the quality profile in the data that's being submitted to the HIE. It's created based on a set of data elements that are measured for the data quality phase or type of participant in the program. And we provide that profile out to HIE participants so that you know where you stand in terms of current data submission, how it compares to the data improvements that have been endorsed by the community and our board of directors for the quality program this year. And can start work. So it gives you a retrospective picture of here's where we are and here's where we want to get to. And you can start the work that's necessary internally in order to close any of those completeness or quality gaps. It's typically measured from July of 1 year to a final period of March in the following year. So what about the incentives themselves? So any hospital, critical access hospital, or other inpatient facility would be paid their 2022 DAP incentive based on meeting data quality measure improvements between July of 2020 and March of 2021. And I'll ask Caitlin in a couple minutes to talk a little bit more about this because I know we just sent out the data quality profiles for that period. Additionally, it's anticipated that for the following year, contract year ending 2023, DAP incentives for hospitals and other inpatient facilities will be paid based on meeting quality measure improvements for July 2021 and March 2022, so that time period. As well, because IHS 638 facilities and integrated clinics for the first time will be executing a quality scope of work. So we would anticipate that year 2023 DAP incentive would be paid based on meeting data quality improvements in that same period, July 2021 and March 2022. How are the HIE data quality metrics determined? We actually have a whole process that we go through. Let me skip to process. We start with our data governance and clinical advisory councils. These are community councils with broad representation across the healthcare community, including many of you that are in the audience, the organizations participating, as well as health plans, ambulatory care providers, behavioral health, a whole group of individuals. And we really work with the councils to identify areas where improving data quality would have significant return on investment for all HIE participants. So a really good example is we've been working with hospitals who've been involved in the quality initiative now for a couple of years. The focus was really on making the ADT, admission discharge transfer alerts, as complete as possible so that we're returning good data out to other treating providers when their patients are admitted and seen in an AD or admitted to a hospital. We take that feedback from the advisory councils and draft recommended focus areas for data quality, as well as the standards around them. So for instance, what criteria would we use and what % improvement would we expect to see between the baseline and the follow-up period, and what's included and what's excluded. That's important too. The Data Governance Council is the final say on approving the HIE data quality standards for each phase. And those quality standards are then presented in draft to the Health Care Board of Directors for their review and feedback before we initiate a public feedback process where we would share those proposed standards with stakeholders in the healthcare community that would be impacted by them. So in your case, it would be all of you in the audience, and back to the hospitals that would be participating in the program, as well as the IHS 638 facilities. So there's a comment period, The final feedback gets incorporated into the draft, and the drafts are then approved by the health current board of directors. And then we submit them to Access, and they are folded into the DAP preliminary public notice of the following year, which of course also has a public comment period attached. So if you look in attachment A and B of the preliminary public notice, you'll find these documents attached there, which describe the measures that are currently in place for hospitals, as well as the criteria that I went through earlier about achieving, overall completeness, 10%, 60% on each of the measures, and then what the overall completeness score looks like. This is just an example of equality profiles for admission and discharge transfer rates. So for instance, up here in the upper left corner, measure group 1 is that data source and site. And so it's simply a complete incomplete comparison based on the number of elements submitted. Measure group 2 is you don't pipe, so it's through the measures. And then an overall aggregate score for the overall completeness based on the other 4 groups. This is a snapshot of an actual data quality report card that gets sent to Access. Can't really see it, so here's an up-close version. Yes, so we do provide Access with this data about which of the participating organizations are meeting the quality incentives and which do not, and that becomes the basis upon which they pay the incentives for each particular measure, and then again on the aggregate score. So these would be the reports that you would be seeing. Okay, and we'll take this last 4 or 5 minutes to talk about how we get through the LOI and DAP milestone process as efficiently as possible, so everybody has a chance to get paid. So milestones, again, vary by provider type. They are progressive over time. So if you're just looking at joining the DAP program for next year, you're coming in with a higher bar than if you had joined for the 2021 program. These slides will, next set of slides will talk about the respective roles and responsibilities. It's really important that you take a look at that public notice and review the milestones that apply to your organization. So that you have someone there within the organization who's really your DAP person, your DAP go-to, and can be sort of the coordinating point for all things DAP at your organization. If you are currently a health current participant and have any questions about the DAP public notice or where you are in your milestones or anything along the way, feel free to reach out to your health current account manager. And if you're not currently a participant but want to be, you would reach out to recruitment at healthcurrent.org. We also have Jamie Pena available on the line to answer questions if you're not yet an HIE participant and you want to be in that. So the first milestone, of course, is executing that participation agreement. We're asking, if you're a new participant, to review the agreement, get it returned to us by March 28th so that we can ensure it's fully executed by April 1st. Again, if you are an IHS 638 provider, you're new to the DAP program, you actually have an extension on this particular requirement. On our end, we will manage the participation agreement process, execute it once we've received it, get you linked up with your new health current account manager, and make sure that you're set up for being onboarded into the HIE. Just as a note, we very rarely change our agreements. So if there are things that you have heartburn about with the agreement, let's get you in conversation with Jamie Pena. It's unlikely we will change anything because we have, close to 900 healthcare organizations in the state, all on the same agreement. So it's just not likely that that's going to change. Next Next document to be signed for those for whom it's applicable would be to authorize the data exchange scope of work. Actually, this is just the outpatient clinics and nursing facilities because all the hospitals should already have the data exchange in place. That's an October 1 deadline. That's that means it doesn't really apply to y'all. Electronically submit any data that's been required. So we're staying in contact with Health Current related to getting an interface developed and live. That way we can make sure you're in time to meet all DAP deadlines that are associated with connectivity, access, and sending data. This does apply to this group, which is the data quality scope of work. Again, we have a November 2021 deadline for that. You want to work with your account manager so you can get a copy of it once it's available in advance. Review and be able to ask questions. We will create a standard template. In my experience, these are fairly high level, so there's not a lot of legalese or anything to it, but we do want to get the scope of work in place so that we can start moving toward those data quality profiles and the preliminary and final reports, because those will be due just a couple months later. Complete that initial data quality profile. So continue to work with Health Current on anything required in order to take action on your initial data quality profile, and or ideas and thoughts about what you can do within your own workflows or your own technical specifications in order to close any gap that's identified for the quality profile. We will use the data segments that we're sending in to create that quality profile and share it with you as soon as we have it. If there's anything that stands out for us in terms of identifiable gaps, we'll make that known to you so that you can initiate any action you have at your back end to get those closed. And then the final data quality profile. Mitigating issues, reducing any data gaps identified from the initial quality profile that are still lingering. There's always time to work on these all the way up practically to the bitter end of the deadline, because we really want providers to succeed at this, and we really want hospitals to earn their incentives. So we'll do everything that we can to make sure that you have the data that you need and the profiles that you need when you need them, and that opportunity to work to mitigate and close gaps. So our job is aligning the resources at our end to make sure that providers can be successful by May 1st, 2022. And then we submit all those calculations over to Access to begin payment. Okay, right on time. I'm going to just pause here and see if we have questions in the chat. And I'm inviting Caitlin and Jamie to join me online.
This is Kristen. Pull up the chat box, or would you like me to read what's there?
Certainly, that's fine.
What's that? I'm sorry.
Yeah, I actually don't think I can see the chat, Christine. So
you can.
It would be helpful if you could. Can you read it? Oh, no. All right. Okay, so the first question that I'm seeing in the chat, which is from Valleywise, is a non-HIE DAP requirement. So this relates to care coordination agreements between IHS and local hospitals, but that is not an HIE related DAP requirement. So the place to address that question would be with Access. Okay, good one for Caitlin. Are you still measuring AO3s, or are you now including other ADT transactions? I can't tell if Caitlin is on the line.
Hey, Christine,
Okay.
but it's very helpful.
Are you able to check yourself, Caitlin? You can see this.
And I only saw,
I can read the question again.
I think the audio is really hard.
Okay, let me try the question again. Are you still only measuring AO3s, or are you now including other ADT data transactions?
This is Craig Sanderson. I didn't ask that question, but I'll follow up after the meeting.
Okay.
Yeah, Greg, if you want to send it to me, I'll be happy to respond. Sorry, I just don't have that questions right here in my view.
This is Christine. Here, the question was, this may have been answered earlier in the presentations, but if institutions, all provider types are able to have I'm going to mute you for just a second. I think that's where I'm getting the feedback from. But if institutions that meet multiple provider types are able to have multiple incentives for participation, for example, a behavioral health hospital in IHS 638 could qualify for all of these categories.
Say we would defer that to Access if you want to reach back out to Access, or we can follow up for you. In the past, we have seen it's per location. So if you have multiple services or within the organization, but then it could be credentialing based of those services. So if you want me to, I could definitely reach back out to Access and clarify that for you.
Thank you, Caitlin.
Just a reminder, the chat box is open, and if you do have questions, we do have the team here. If you would like to come off mute, you can. We're just trying to control that through the chat feature because we're getting a lot of feedback. So again, that chat feature is open. We're happy to answer any questions you have regarding the DAP CYE 2022 program.
I can ask a couple questions that have been common from past DAP webinars. So if you're already meeting milestones as part of the current year 2021 DAP, do we still need to submit a letter of intent for 2022? And I believe we went over that at the beginning of the session. And yes, differential adjusted payment is a year-by-year program. So you have to apply and be qualified and eligible for each additional year that you want to participate. So you may be in active in the DAP program this year. You still need to submit a letter of intent by April 1st in order to be in the new program that starts 10/1.
Steve, were there some that may have come through from prior year programs that you can share?
Yes. So these are examples of the kind of questions we've had in the past. How does an access provider know if they qualify for differential adjusted payment? So again, you want to look at the preliminary public notice, including the specific access provider types that are listed in that notice as qualifying for DAP. It is based on provider type. So you want to make sure that the provider type that you want to submit for is one that is on the list. We've had a lot of questions about that in the past. Is the DAP adjustment to the contractor managed care organization payment rates or the access fee for service rates? And there's been no change in this. It's still a positive adjustment to the access fee for service rates. And access requires that the MCOs, or managed care organizations, including REITs, are required to pass through that DAP increase via their contracted rates to match the corresponding access fee for service rate increase percentage. There are nuances in the way for each provider type the claims get paid. For some providers, it may be on all claims generated from that particular location. And for some provider types, it may be limited to a particular subset of select services. So you really want to look at the detail. And the first opening paragraph under each provider type goes into that information. So it will tell you, is it just on my hospital services? Is it on my hospital and my ambulatory services? Is it just on a set of codes within all my ambulatory services?
We had another. The question is, if we previously qualified for DAP, however, are not showing the current year, who can they contact to find out if we applied and were denied, or if we failed to submit the LOI?
So I do know every year in the fall, Access reposts the official list of DAP participating organizations. So by around next October, you would know if you successfully were qualified into the 2022 program, and they actually post that list on their website. I can't speak to the current year. That would probably be a question to Access, but I do know that there's a list available. And if you haven't found the list or looked for the list, take a look at the Access website, and you'll be able to find it. They have their own DAP webpage where they post that. This slide deck will be posted on the Health Current website after the conclusion of this webinar.
We'll also send it to all of the participants as well, with a link to the recording of today's presentation. Christy, I'm afraid we hear you if you're sharing information on these prior FAQs.
I am not. I was waiting to see if there was going to be another question in the chat. I'm not seeing anything. So if you're new to DAP, what's the first step? So again, if you're a current HIE participant and you have an active participation agreement, your first step is to reach out to your account manager. We'll first send in an LOI. You can do that today. We are accepting LOIs as of last week. And then reach out to your account manager with any questions or to make sure that you know what your milestones are and what you need to do in working with Health Current to accomplish those milestones. If you're not a current HIE participant, you will be reaching out to our recruitment team. Jamie, I know you're on the line. I don't know if you have anything that you'd like to add to that.
I think Christy, you covered it. If you can just email us or call us at the contact information provided in the presentation, we'll be happy to answer any of your questions and get you signed up.
Christy, are you able to slide back over to the PowerPoint presentation and maybe share the slide that has the contact information both for DAP as well as for Health Current?
Can you see that?
Okay. Thank you.
Yes. And again, there's a template for each provider type already posted on the Health Current website that has all the milestones and requirements for 2022. You just go there, pull down your provider type, or in some cases you might have more than one provider type you're submitting for. Pull down those templates, review them, get them signed, email them into both access at dap@healthcurrent.org, and we'll get you in the system.
Wonderful. Thank you so much, Christy. We have about 5 minutes left, folks. So if there are questions for Christy Dye or any of our client support or recruitment staff, they are here on the line to answer those questions. You're welcome to type them in chat. Just a reminder that a copy of today's presentation will be sent out to all participants, and we will post that on the Health Current website. We'll pause there for just another minute to see if there are any additional questions in the chat box before we close out today's presentation.
Well, I'd certainly like to thank everyone for attending, and we always get excited to launch DAP each year at Health Current. It's a lot of work that we all do together, but for the many patients that we serve in the healthcare system in Arizona. And we're delighted to start that journey again with you. And send us an LOI. Thank you.
Thank you again, Christy. And with that, we are not seeing any additional questions coming through our chat feature. So we'll go ahead and close. Oh, yes, somebody there?
Sorry, this is Steve from Northern Arizona Healthcare.
Hi, Steve.
When you're talking about we've already, I believe, signed our letter of intent. But when you talk about the reference lab agreements that we need to sign, which labs are you guys? I know you guys are interfaced with Quest, but who else is it? LabCorp?
LabCorp, Steve, LabCorp is the main large lab computer provider in the United States that requires an individual authorization by each provider. They won't do a direct fee to Health Current without the provider's authorization. So that form that you'll find on the website is for LabCorp, yes.
Yes, we already send our LabCorp results through our ORU feed to you guys. So are you saying that now you guys can get a live HL7 V2 feed from LabCorp?
Hey, Steve, this is Caitlin. That is correct. And we can work with you with your account manager to ensure that all of the milestones are being met for the reference lab.
Cool. Thank you.
Yep.
Thank you so much for that question, Steve. Again, we've got another minute or two to go. So again, you are welcome to come off mute if you'd like to ask our presenter questions, or Jamie Pena, our recruitment manager, Caitlin, who is our account manager, regarding today's presentations. If not, again, visit our website at healthcurrent.org/DAP. You can send an email to dap@healthcurrent.org or recruitment@health. A copy of this presentation will be sent to everyone along with a link to the recorded session. With that, we are wrapping up today's presentation. I don't see any additional comments or questions in the chat box. Thank you again for participating in today's DAP webinar. And if you have questions, again, please reach out to the folks that can best answer those. Thank you again and have a wonderful day.